Obviously, epilepsy can result from many, many different causes, right? Anything that damages the brain, be it a stroke, an infection, a developmental anomaly, can result in epilepsy. But one of the ones that is very recognized to do that is brain trauma. And I think the estimates are that approximately 5% of all epilepsy is due to brain trauma. And that could be a bit of an underestimate, actually. But this has been known for a long time, and I think there's been a lot of interest in using post-traumatic epilepsy as a model of epileptogenesis, right? So one of the problems that we have in developing anti-epileptogenic therapies is that most of the time we don't know when the initial inciting event that led to epileptogenesis started, right? I mean, for people who develop epilepsy from a developmental problem, et cetera, we don't really know when the initial inciting event happened. Therefore, we wouldn't really know when to start therapies for that. Whereas with brain trauma and with some other conditions, I think we know pretty clearly, when the insult occurred that led to an epileptogenic, eventually led to an epileptogenic circuit. And there have been attempts, really going back many decades, to use anti-epileptic drugs or potentially other kinds of treatments to block the epileptogenic process. And frankly, those have all been unsuccessful. There's been some success in animal models, but certainly anything in clinical trials has all failed. So really the motivation for really my research program, and then I've been working on this for a long time now, is try to understand on a granular level, on a detailed granular level, what is the epileptogenic process after brain trauma? Meaning, looking at things like what are the biomarkers that are telling you something about the epileptogenic process? What are the imaging features that can tell you something about the epileptogenic process? Potentially, what are genetic features that tell you something about the epileptogenic process? And that's the kind of information that really we're going to need if we're ever going to be successful in testing and ultimately developing anti-epileptogenic therapies. I think one thing that we've discovered over the last several decades, and this is work from my lab as well as from many others, is that post-traumatic epilepsy actually is fairly heterogeneous, right? There are, and a traumatic brain injury in itself is fairly heterogeneous, so we should not be surprised that the epileptogenic process after brain trauma is also heterogeneous. So many people who develop epilepsy after having had a traumatic brain injury, that's a consequence of them having had a focal injury, meaning a contusion or a bruise in the surface of the brain that over time, as it scars up and there is some plasticity around the edges of the scar, that ends up with an epileptogenic circuit. So that is actually the most easily understood model, and historically that's the model that has sort of received the most attention, and that clearly does happen. However, one of the things that we've discovered is that at least half of people who develop post-traumatic epilepsy do not have any focal contusions or any focal scarring in the brain. And the injury in those cases are due to diffuse mechanisms, which are also very well understood to occur after traumatic brain injury. And these diffuse mechanisms are things such as axonal shearing or axonal stretching. They can also include blood-brain barrier disruption or other disruptions of the microvasculature or neuroinflammation, which can be more diffuse. And that actually is actually a pretty significant as well. And it's not something that has been as widely studied in animal models in the past. And that's a common mechanism. So obviously you would hope and believe that at some level, at some fundamental molecular or cellular level, there are going to be similarities between epileptogenesis after a focal brain injury compared to epileptogenesis after a diffuse brain injury. And I think that's kind of where we are right now, right, to identify what features of either imaging or biomarkers, et cetera, would point to potentially some of those similarities, which are things that could be targeted for therapies.